Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Maruf Mumtaz, consultant clinical psychologist and student counselor at Rashid Latif Medical Complex. Rashid Latif Medical Complex is thoroughly honored to have you all here to grace this occasion. Breast cancer awareness is very vital, so this e-seminar is on psychological support, lifestyle, and stress management for breast cancer. It is joint venture of Counseling and Wellness Center, Rashid Latif Medical Complex, Rashid Latif Khan University Proposed, and Pakistan Association of Lifestyle Management. Before we begin, I would like to pay my special regards to the chief guest of this seminar, Honorable Emeritus Professor Dr. Rashid Latif Khan, Chairman RLK Associates, who is a living legend for all the communities and professions. Professor Emeritus Dr. Rashid Latif Khan is pioneer, author, and medical practitioner par excellence. He is the Pakistan's first gynecologist to be awarded Sitara Imtiaz, the first to introduce IVF technology, the founder president IVF Society of Pakistan, the first doctor from Pakistan to introduce diagnostic laparoscopy, and the list of his achievements and honors goes on. Sir, we are extremely grateful for having you today with us in this seminar. I would like to extend my gratitude to Madam Sabahat Khan, CEO RLMC, Professor Dr. Aftab Mohsen, Principal RLMC, for encouraging professional growth for students and professionals. I here must say that there is a big name in psychology, Professor Dr. Nashi Khan, an Iron Lady, a warrior, and a survivor of breast cancer. And Allah has blessed her with immense energy and true workaholism. I further extend my extreme gratitude to Professor Dr. Rubina Suhail, who herself is a big name in the field of gynecology and obstetrics. And our special thanks to Dr. Shagufta Feroz, President Pakistan Association of Lifestyle Medicine, who have honored us in this e-seminar. I would like to pay my regards to highly esteemed speakers from academics, research, and practice who spared their time to be with us. Now, I would like to invite Professor Emeritus Dr. Rashid Latif Khan to grace this event with his address. Sir, the forum is yours.
Bismillahirrahmanirrahim. First of all, I must thank the organizers of this webinar who have invited me to join this very important subject of the day, breast cancer and its management. And they have picked up the most important part of the management of breast cancer, that is psychological support. You know, when somebody is told that you have cancer, the first reaction of the person is the diagnosis is wrong. It can't be me. God can't punish me with this problem, which perhaps has got devastating effects on the future of that person. So this belief, but gradually with various tests and counseling, it creeps in, the diagnosis is correct. Then in addition to the medical treatment and surgical treatment, the patient needs psychological support. We are lucky we're living in Pakistan. We have a joint family system, we have brothers, sisters around, and they are there to help the person emotionally, socially, and financially as well. So that way we are lucky. But still, the disease itself is devastating. It leaves permanent impact, not only her future health and future well-being, the emotional upset which she suffered from. I remember that one of my colleagues, she had this problem, and she put it like this, that people don't know, the knowledge they have about this problem is like a drop in the sea. It's a huge problem, which we fail to evaluate and treat globally and especially in Pakistan. But all this problem, I must compliment the organizers, particularly Professor Nashi Khan, whom I have known since she was a little kid. And she herself is a model. The way she has beaten, I would say, the problem and led normal life, as a matter of very aggressive and progressive life. And that is a model for all other patients. And by organizing this, most informative, the speakers, the topics I've seen, I'm sure at the end of the webinar, all of us will be wiser because of their input. They are all very experienced, knowledgeable, and they we are going to contribute to our information. Where I'm sure this component of treatment of breast is going to be highlighted in the way that we take care of the patients psychologically as well. Just medical or surgical treatment is not good enough. It's not enough. Definitely not complete treatment. And for that, they need psychological support. So the webinar, which is going to uh, put forward how to manage the stress of this disease and support as professionals, as doctors, generally we feel that we have done enough, but it's never enough. The counseling component, the social support component generally is not up to date in our country. We have to pull it up, and this seminar is going to help us a lot in doing that. And once again, thanks to the organizers for inviting me to be part of this important seminar. And secondly, I also compliment the organizers for selecting the speakers and the topics which are very important. Thank you all, and wish you a good seminar and successful seminar, and best of luck. Thank you.
Thank you so much, Professor Dr. Rashid Latif Khan, for these enlightening views. Due to some other commitments, Ms. Sabahat Khan will not be able to join us today. So moving forward, I would like to invite the leading personality behind RLMC, our worthy principal, Professor Dr. Aftab Mohsen, to grace the seminar with his welcome address. Professor Aftab Mohsen have diverse practice, decades of experience, and higher level experience of steering different institutes with knowledge and vision. Sir, over to you. Principal sir will be joining us in few moments. So I would like to invite worthy Professor Dr. Nashi Khan, the untiring personality for whom there is no end to work and perfection, for the opening for the welcome address. Madam, please.
बिस्मिल्लाहिर्रहमानिर्रहीम। शुरू करती हूँ अल्लाह के नाम से जो बड़ा मेहरबान और रहम करने वाला है। I welcome you all, especially Professor Dr. Rashid Latif Khan, who has graced this occasion just on my one phone call. And I feel that to say, why हमारे घर में खुदा की कुदरत है, कभी हम खुद को कभी अपने घर को देखते हैं. I would like to thank Professor Dr. Aftab Mohsen, Principal RLMC, who is a legend in his field of gastroenterology, a thorough professional, and a very dear friend, and a beautiful soul. Not only a soul, or also a beautiful face. I welcome you, sir, in this seminar for giving us time. I welcome Professor Dr. Rubina Suhail, a very dear friend who herself is a big name in the field of gynecology, and Dr. Shugufta Feroz, President, Pakistan Association of Lifestyle Medicine. I would like to thank to all the speakers from academics, research, and practice to be with us. And we'll definitely miss Ms. Sabahat Khan, who is busy today and will not be able to join us. I request Professor Aftab Mohsen to give the welcome address. Over to you, sir.
Assalamu alaikum, sir. We welcome you and we thank you for giving us time. Uh, we are honored to have you here today with us. Sir, please give the welcome address and honors this event. Thank you so much, sir. We will formally commence our e-seminar. So moving forward, it gives me huge honor to invite the special guest of the seminar and the chairperson of Department of Psychology, DC University Lahore, Professor Dr. Saida Salma Hassan. With decades of experience in educational field, trainings, research, and higher level leadership, we are honored to have you today with us. Ma'am, over to you. The forum is yours. Dr. Salma, we cannot hear you. Can you please rejoin us? Ma'am, your mic is mute. Please unmute the mic first. We cannot hear you. Ma'am, we still cannot hear you. Your mic is mute again. No, ma'am, you are not audible. Sorry, ma'am, we cannot hear you. No, ma'am, we cannot hear you. Professor Dr. Salma Hassan will join us in a while. So, moving forward, with immense gratitude, I would like to invite Dr. Fatima Kamran, Associate Professor in Institute of Applied Psychology, University of the Punjab. Dr. Fatma is an eminent scholar and academician in the field of psychology, and with more than 20 years of teaching experience, she has her PhD and postdoc from University of Surrey, UK. Ma'am, the forum is yours. I would like to invite Dr. Humera Mohsen, consultant clinical psychologist at Fraser Health Authority of British Columbia, Canada, registered with the College of Psychologists of British Columbia, Canada. She is also a proud member of Pakistan Association of Clinical Psychologists and ex-vice president of Pakistan Association of Clinical Psychologists. Ma'am, over to you. Sorry, ma'am, we cannot hear you. नो मैम सॉरी आपने आपका माइक म्यूट है एक्चुअली मैम आपका माइक म्यूट है आपकी स्क्रीन के नीचे ऑप्शन आ रहा होगा म्यूट का उसे अनम्यूट कर दें प्लीज नो मैम यस नो सॉरी मैम वी कैन नॉट हेयर यू Moving forward, I would like to invite our very own renowned psychiatrist at RF Memorial Teaching Hospital and HOD Psychiatry and Behavioral Sciences (RLMC), Dr. Usman Amin Hotiana. With his years of practice and experience, we are delighted to hear from you, sir, today. Over to you.
Assalamu alaikum. Am I audible?
Yes, sir, you are audible.
Okay, so let's start. The internet is always a problem, and that's very expected. Uh, Thank you for inviting me. I am extremely thankful to the organizer, and with the permission of the chair, Professor Rashid Latif, I'll proceed. The topic today is very important indeed. Just recently, when my grandmother was diagnosed with breast cancer after the grandfather died of late age and Alzheimer's, so I had a very personal encounter with this illness. It reminded me of my final year training at King Edward Medical University. The outdoor was full of women coming in stage 3, stage 4 breast cancer. Now, male and female, both combined, the biggest chunk of cancer is breast cancer. It is about 30 to 3% out of the 100 of the female breast cancers of all kind. But why is it so delay? Why the patient is coming in like at the stage 3, at the stage 4? What can be done about it? How much awareness can be created? But today my topic is the psychoanalytic underpinnings of a Pakistani woman. The way I see as a psychiatrist, the problem is much deeper than what we can see. It is not about cancer. It is not about coming late. It is about the society's attitude. It is about the society's deep traditions, culture, which is a major hindrance. And I will have. We have all known about the stress management, importance of the stress. Just let me give you a brief revision of the biological structure, which starts from stress. What is actually stress doing? Stress is not just a psychological term. There is a whole biological network which is fired up, starting from hypothalamus through ACTH, hypothalamus signaling the pituitary gland signaling the adrenal cortex signaling the whole system through activation of something we call sympathetic nervous system. Increase cortisol, increase catecholamines, and increase adrenaline. ये सब चीजें, all these factors over a prolonged period of time is harmful. The molecular science have shown that all bodies which have increased expression of beta receptors are linked to cancer. And I won't go into the molecular details, but just for the students, because the audience is mostly our medical students, the tumor suppressor genes, the regulation, the small cellular structures like messenger systems are invigorated, the receptors are increased, the cell, in simple terms, the cells start to die at an early age. This is the biological part. But what is instigating the stress? So I thought about it when I was told about this topic, and I thought that a Pakistani person, a woman, the moment she's born, a lot of stress is already kind of for her. We're not talking about the privileged class. I'm talking about the lower middle, lower, and the quickly going to the low side, the middle class also, because we are all entrenched with poverty. We are entrenched with strong cultural restrictions which are on our mind. A recent study in Turkey has a slightly similar to ours, that showed what they did was they interviewed a qualitative interview of breast cancer patients from 6 to 24 months after they had contacted a breast cancer. And strikingly, after those detailed interviews, they found that four things were common in all the women. Number one, they had a striking stress between the age of 19 to 14 years. A very common stress which I on daily basis see in the RF Memorial Hospital, kids coming, for example, ending of the education. It's very commonplace कि लड़की की तालीम रुकवा दी जाए. It's not really important. The second factor they found was a long-standing stress, and mostly it was in the form of a marriage. Marriage comes out to be the most important part in a Pakistani women, because even if they're educated, unfortunately, even if they're doctors, their fates are sealed with the decision of the marriage. I just saw this one patient who was married off to an older person who was on drugs, and he put the girl also on drugs, and she had no way out. And this is happening on daily purposes. And I'm right now, because all the faculties here, all the students are there here with us, on daily basis, I have to call the parents of the medical students, telling them that they are in stress, they probably need some stress management. Sometimes if they're suicidal, they need intervention in form of antidepressants. But the stigma of stress is such, stigma of psychiatrist, psychologist is such that the response is usually in a very horrifying way. And it is acceptable because we are not right now as a society very psychological minded. We try to fix. And the other thing which is not very surprising, a lot of even the faculty, I'm sorry, but all the faculty non-psychiatrical, sometimes they also reinforce these behaviors, saying कि नहीं अभी तो you are very too young to start an antidepressant. You are too young, just try some talking therapy. There are talking therapies, of course, and I'm a big fan of it. I just believe in CBTs, all these kind of therapies. I myself have a strong interest in psychoanalysis, but sometimes the medication will be important. So the Turkish study saw the second one was a long-standing stress. Third stress was exactly before coming out with this breast cancer diagnosis, there was another stress 2-3 years back in all the patients. Now, the story I'm creating is that human body is a very tightly controlled, signal-based organism where each cell is connected to the other cell. Since we are very objective kind of society, we're not into subjective. We don't really care what the person is feeling. We care more about how the person is behaving. So we have a very strict traditional control of systems. But when this system is disturbed over a period of long time, when this system is kind of in the form of bullying, sibling rivalry, the stress of the studies itself, which is increasing day by day, the unemployment pressure, the young parents which are now separating from this extended families, they have new challenges coming up. All these factors have a part to play in the starting of a cancer, and the studies are there. We are just not looking. Very briefly, I would like to comment on the role of media. The media is sporting a certain kind of narrative. Just to light the talk, if I can quote one or two dramas. अभी एक drama आया था खुदा और मोहब्बत और एक थी निगार. These are two dramas. In drama में what is being forced is that the woman who is not expressing her desire, her own choice regarding the romantic issues, regarding her personal choice, she is the best person. It is shown that the custom of being silent, the custom of listening to the authority, that makes a woman a better woman. लेकिन अब मसला ये कि the youngsters are not the same youngsters. We are the population. We listen to our adults when we were young, but now we have to listen to the kids also, because there's a whole skip of some generation thing. Now we have entered the digital age. The digital age is where there is so much awareness that we have to deal with those difficult questions which are there somehow, which are in the air. I will just conclude this session that the purpose, the reason I think we are here today is to increase the awareness. My concluding message would be that every woman in Pakistan has a right to take a decision which is about her life, whether it's about saying no uh, to a host of things. But right now, the topic is a right to medical treatment and diagnosis. And that right should be right from the start. It should not be the whim of a husband that I don't want your wife to be checked by some doctor. We have very less doctors, but still, anyone who wants to come and be screened for breast cancer, we need to bring this facility to the door level, to the lady health workers level, to the tertiary care hospitals. So early screening, early diagnosis, and a good management would be coming. Thank you very much for listening. I'm obliged.
Thank you so much, Dr. Usman. Moving forward, it gives me immense pleasure to invite Professor Dr. Rubina Suhail for the opening address, who is consultant obstetrician and gynecologist at Hamid Latif Hospital, ex-HOD in Services Institute of Medical Services, chair of FIGO Committee on Violence Against Women, author of many books and chapters, past president of South Asian Federation of Obstetrics and Gynecology, and award holder of Young Gynecologist by the Asia and Oceania Federation of Obstetrics and Gynecology. Thank you so much, Dr. Rubina, for joining us today. Over to you. The forum is yours.
Thank you very much. Very good morning to all of you, and I'm extremely sorry to have been joining a bit late because somehow the internet was not getting through. So thank you very much for this opportunity. I think you've chosen a very, very important topic, and this important topic is very close to my heart. And as I present, you will understand why is this topic very close to my heart. In addition to the fact that I'm a gynecologist, and it should be a topic of extreme interest for me. First of all, I would just like to mention Dr. Usman Hotiana. I really enjoyed his presentation, and I think that he made a lot of sense when he said that the media is conveying the wrong kind of messages, and we need to ensure that the media understands what their messages should look like. I will start my presentation, and this is for the students from the point of view that when we are dealing with patients of breast cancer, we think that we have to provide them treatment, and that is all that we think of. We do not think about the stresses that they face, we do not think about other issues that women with breast cancer are going to face, and that is why somehow we are not able to become as good doctors as we would envision to be. So I'm going to start with the story of my sister. This was the year 2006. She was 41 at that time, and she was going through a mammogram for routine screening of breast cancer, and she was diagnosed microcalcifications on a mammogram. They advised a biopsy, and the biopsy revealed an intraductal breast carcinoma. She had three children. Her youngest daughter was 8 years old at that time, and she was extremely busy in a 9 to 5 job with MetLife at that point in time. So, such was the level of her anxiety regarding the diagnosis and regarding the repercussions of treatment that the first thing she said to me was that agar Allah Miyan ki yahi marzi thi, to let it be, and I don't think that I need to go for treatment. And she is a very empowered woman, and hearing this from a very empowered woman really saddens you that this is the kind of impact that a malignancy has upon a person. So there were household pressures of raising children, and she went for treatment, went back to work, but was eased out of the job and could not find work for the next 10 years. So this is my starting point, and I'm going to refer to her and her story off and on during my short presentation. So the outline of my presentation is the burden of disease we have, breaking the bad news, coping with malignancy, and the treatment is about survival and living as a survivor of breast cancer, what it means and what are the implications. So to start the ball rolling, I'm sure probably you don't know, but most of our faculty is aware of the fact that around 15% of cancers in Pakistan are breast cancers, and this is the highest burden of any malignancy in the country. So, having said that, 1 in 9 Pakistani women are going to develop carcinoma of the breast at some stage of their life. And I'm not going to share that picture with you, but I would just like to share the fact that out of so many trainees who work with us, there is a reasonable number of OBGYN doctors who themselves are suffering from breast cancer. So when we say 1 in 9, most of the time people think that it is not us, but it is 1 in 9 Pakistani women. And we forget that we are amongst those Pakistani women. And if we are sitting in a room full of 90 women, about 10 women out of that percentage is going to develop breast cancer, whatever you might do, and that is a significant number of breast cancer. We are the highest numbers of breast cancer in Asia. 10.2 million women are at risk in Pakistan. 77% of these women are above 50, and most of the time, the issue is that these women are going to present with late cancer staging in stage 3 and 4, and that is actually very significant. And also the fact that 83,000 cancers are reported annually, half of them also die annually. So that is a challenge, and the challenge that we have to get into. Now, I am not looking at the numbers as such, and I'm not looking at what kind of treatment is provided, but I am looking what happens to a woman when she is given the news of breast cancer. And that is how we are going to talk about today. So there is shock. There is an absolute denial. This can't happen to me. Then you become angry. And they go through this emotion that why me? Why did God chose me to undergo this terrible fate? Then there is fear for the family. There is worry. There's a lot of stress, as Dr. Hotiana was talking about stress. But having a diagnosis of breast cancer is extremely stressful, leading to sadness, depressions, and all the negative emotions actually that you can think of. So the question is that once we have broken the bad news, how is the woman going to cope with the diagnosis, and what are the areas where she needs to be coping with? So the first area that she needs to cope with is obviously her emotions that have to be harnessed into positive emotions and not continue to be depressed. Then her physical needs, because her body is going to undergo a radical change. Commitment to the family, what is going to happen to that? It seems as if you are running and all of a sudden an obstacle has been placed in front of you and you are told that you cannot run this race anymore. And if you have to run this race, then these are these hurdles. So all these are the hurdles which we have to deal with and help her cope after the diagnosis. Then her sex and personal relations, as again I would refer to Dr. Hotiana, that people do not talk about sexual relations, and it is very important to bring up this topic. And as doctors, we should not be embarrassed in dealing with patients with breast cancer. Rather, we should bring up the topics for discussion, and you would be surprised to see that the woman is relieved that she's able to express her point of view regarding these. Then the fear of side effects of the treatment that she's going to get, and so much personal insecurity that is going to be accompanied. Now, when the treatment is started, the first thing is that during the treatment, the only and the most important thing that is important that the woman has to think about and that we have to encourage is about her survival. That she has to survive, and that survival instinct has to come into play because the treatment is not easy. It is loaded with side effects. If you feel as a girl, and so many of the audiences would be girls, if you feel that your hair is thinning, even without breast cancer, that is a lot of stress for women. So, but she's going through that hair loss, the nausea and vomiting, no desire for food, fatigue, menopausal like symptoms, lymphedema, loss of sex drive. These are, I can say it in 30 seconds, but these are big things happening to the woman. And moreover, she cannot continue with her personal and professional commitments, and she many a times needs actually support and help from home. So, what is the way forward, and what do we tell the woman? How do we take her forward from there? The first thing is that the hope should never go away. And we should tell her that this is something which can be dealt with, and this is a cancer which has got significantly important treatment strategies available which can help her lead a normal life. So, hope has to be there, and she has to be courageous and bold, and she has to stand up erect in the face of adversity. And she should be grateful to God that God is providing her this opportunity to diagnose it and get it managed, and she will be very happy to be alive and okay in a couple of months or years' time. So, if she survives through the whole ordeal, she becomes a breast cancer survivor. So, the question is, Do we ever talk to our patients and tell them that she is a breast cancer survivor? We are proud of her. And what does she need to do and do now? And what does she need to know? So we never talk about these things. And I think that it is very important rather than becoming doctors. And here the multidisciplinary approach becomes very important. The psychology department, the psychiatry department, all the people who can counsel and talk are becoming very important. So the woman, it is not that you don't have time. Number one, we have to find time. Number two, we have to find the right people who can talk in appropriate language and appropriate terms, which would make the whole thing understandable to the woman and build her capacity to survive this period after treatment. So, what does she need to know? She needs to know that getting back to life, it's not going to be the same life anymore, which she realizes very quickly. So, we have to tell her beforehand that she has to prepare herself for a different life, because many a times the family expects that the treatment is done and now she should be back to normal. What is she? Why is she behaving like this? So the family also has to be counseled. Then the personal expectations of the woman, that she thinks when she goes back she will find everything normal, which sometimes a lot of things have changed. So the workplace environment is also sometimes not the same anymore, and that also has to be told to the woman that you will have new challenges and you will have a new normal which you have to cope with, and we will help and support you going through that phase of your life. The follow up and medical care is extremely important, and the woman needs to be told that she has to follow up for life. As long as the doctors keep on calling you, you have to be there, and also to make her aware and not to depress her about the late effects of cancer treatment, which we need to keep an open eye about. Now, she would be facing a lot of effects of the treatment that she took. As I said, that there would be changes in the skin, the hair, scars on the body, loss of a very, very important part of the body for the woman, the breast, changes in weight. She would have lost of fertility, vaginal dryness, muscle weakness. So the list is endless, but there are a lot of things that are going on, and she should know that these things are manageable and we will find ways to help her deal with them. So this transition to the new normal is challenging, and the women find now they are looking at the world, their family, their issues in a different way. So what are the issues of adjustment and how can we help her with the issues of adjustment? The body image has changed. So the personal issue, adjustment issue, is that it is a different body. It is a different body image, and her self-esteem needs to come up. She needs to tackle with depression, because coming home, looking at yourself in the mirror, and finding out that you are not the same person anymore is a hugely depressing event. The fear that the cancer might return, finding meaning in life, and not feeling lonely, because the woman finds that she is alone. Nobody understands that what is she going through, because everybody thinks that she is all right now and everything is back to normal, which it is not. And when I was making this presentation, I called my sister and I said that I never realized what you went through. And doing so much research about it, reading about it, going through with it with so many patients, actually made me realize that even I, who thinks that I know and I'm a doctor and I'm a professional and I have a family history at home, even I did not know that there is so much support and help that this woman needs. Then she has the guilt that she has survived, and many women along with her who were getting treatment may not have survived. Then issues with the spouse in terms of intimacy, in terms of sexual ability, in terms of not being able to get pregnant, and in terms of the side effects of menopausal like side effects like hot flushes and dry vagina, so many things going on. And at the workplace, getting back to work, and if you don't have a job, many times financial pressures are also there. And because the treatment is also not very cheap, then some women will have to live with metastasis. And the good news is that breast cancer is almost like a chronic disease now. But there are women who are going to be who need to be mentally prepared for metastasis if they develop so, and help them live their lives. So, what does the woman need? She needs a lot of people to help and support her. That is what she needs. And that is what we don't realize. So, not only is that the healthcare provider does not realize, but the friends, the family, nobody realizes. Only the professionals know and they can help. But this is the information that we need to give her, and this is the support that we need to give her. That the various kind of healthcare providers, right from a counselor, from a gynecologist to a psychological counselor to a psychiatrist, needs to be there to support her as needed. Then the support of the friends and family in understanding her issues and trying to help her find the way forward, not being sympathetic but being empathetic. Then the help of cosmetologists to make her skin look better, the makeup artist to make her face look better, giving help from professionals who can help either in terms of prosthesis of the breast or reconstruction of the breast, a sex therapist. Now, if you look at it, there's so many people who can actually provide that support, but neither does the poor woman know, neither do the poor healthcare providers know. So it is important for the healthcare providers, for the women, and for their family to know that how can we help this woman get back and find her place not only in the society but more importantly at home. So, two things are very important in coping with emotions. The woman should be encouraged to talk. She should be encouraged to say what she feels. And the second important thing is that she should be encouraged to seek help. As Dr. Hotiana said, that many a times even the healthcare providers are going to say, try to deal with it yourself and you don't need to put yourself on medication. Sometimes medication is a lifesaver, and we have to think that we are trying to save the life of these women, and it can only just be a temporary treatment, and then she might be able to get rid of it after a couple of months or years or when she feels better. But it is very important to help her cope with the emotions that she's feeling. And there are solutions to the issue, but the thing is that we have to help her focus on the ways that will make her strong, that will make her courageous, that will make her go through life in a fashion, in a determined fashion, with the support of all of us. And she has to take one day at a time, because things will eventually start getting better, but she has to be there, she has to be relaxed, she has to be courageous and take us all with her. The partner is the most important person, I think, in a woman's life. And if she has a husband who is supportive and who can help her, or anybody else, a friend who can, she has to talk to that person. She has to talk to that person so that the various avenues of support by a counselor or a sex therapist or whatever can be dealt with, and ways of supporting, ways and means of being intimate without being embarrassed and without being awkward about the scars on her body. She should be feeling unashamed, and she should be going with what she has in a positive way with her partner, and that is why the partner's role is extremely important. A lot of women will fall back on faith and spirituality, and it is absolutely okay, because at the end of the day, it is God who is going to support you. So it is good to have that spiritual connection with God, and that is also a great healer and helper. I will bring you back to the story of my sister, because as I told you, when she got her diagnosis, she said, Allah मियाँ की मर्जी है. So अगर अल्लाह मियाँ की यही मर्जी है तो इलाज कराने की क्या जरूरत है? But I asked her to say a couple of lines about it, and this is what she said to me. She said initially it was very hard because she was in disbelief, and she said it couldn't be happening to me. But then eventually, after discussion with the family, when she finally went to the hospital, she said that she was lucky and the hospital had a strong support system for cancer patients who made me understand the disease, helped in dealing with the initial stress. They taught me to take care of my body image as well as emotional needs. And her conclusion was that being knowledgeable was very helpful in coping with the disease. And I still remember her treatment, and she was in USA, she lives there. And she said, the cosmetologist used to come, and various brands of makeup would come because her eyebrows had started falling, and they would tell her how to cover her brows and how to make sure that they still appeared as if they were there. They're small things, but these small things matter. So eventually, when her treatment was completed, she was extremely nervous about going back to work, because she says that I knew my supervisor and co-workers would be supportive, but I was afraid they would think I couldn't do my job like I used to. And that is actually what happened with her, because they thought that she wouldn't be able to do her job the way she used to, and that is why she was eased out of the job. And this is her message to you, and she says that as of today, I'm a 15-year-old survivor of breast cancer. My only follow up is a mammogram, DEXA scan, and blood work yearly. And the recommended oncological visits are every 5 years. And this is how she looks like now. And if the students can see this, this personality is regained from the original personality, and this personality is the one which you gain when you have support not only from the healthcare professionals but also from the family, friends, counselors, psychiatrists, and number one, to have an empathetic doctor. So, the message that I want to give to you today is for all of us to become empathetic doctors and to be proud of the survivors and to tell them, even if they're in your family, to tell them, your friends. And today I'm telling all my friends that I'm so very proud of them, the way they have fought the disease, the way they have continued to move, the way they have continued to help other people bridge the gap and to reach an area of safety where there is mental calm and the emotions are in check and there is a happy future looking forward with the family and the friends to go through life in an easy manner. With this, I would like to thank you all very much and end my presentation. Thank you. I can answer questions if anybody would like to ask any questions. So if I think organizers will be back in a minute or so, but I think that this is a very important area which we need to work on. We, as doctors, we always keep on working on treatment. You do surgery, you provide radiotherapy, and you think that the treatment is done. The answer is the treatment is not done. And as medical students, you need to have this perspective that there are a lot of other angles to management of breast cancer than only the surgical treatment or the chemo and the radiotherapy. So you need to think from this perspective. And the second thing that I want to say is that you are very blessed to have Dr. Nashi Khan with you and the team at Rashid Latif Medical College who are conducting seminars and awareness programs to discuss this very, very important issue of breast cancer. Hello? Hello? Oh, they're back.
It is pleasure for me to invite the chairperson of Department of Psychology, GC University Lahore, Professor Dr. Saida Salma Hassan, with decades of experience in educational field, training, research, and higher level leadership. We are honored to have you today with us, ma'am. Over to you.
Bismillah Rahman Rahim. Maruf, am I audible now?
Yes, ma'am, you are totally audible.
Thank you very much. Bismillah Rahman Rahim. Respected Professor Dr. Rashid Latif, Dr. Nashi Khan, organizing team and speakers, Assalamu alaikum. Before I share my views on the subject, I would like to extend my gratitude to Dr. Nashi Khan for giving me an opportunity to share my views on the subject of body image and psychological well-being of the breast cancer patients. We all know that breast cancer is the most common disease among the women all over the world, but advancements in its treatment have enhanced the life expectancy. The World Health Organization in 2020 in its report has stated that 7.8 million women are alive who were diagnosed with the breast cancer in the past 5 years. Breast is a symbol of charm, it is a symbol of sexuality, it is a symbol of femininity. And any damage to this organ of body can damage and can bring harm to women's life. The most devastating psychological impact of the disease is on the body image. Now, what body image is, all learned people are present in the seminar, and we are all aware that body image is a subjective appraisal of one's physical appearance, and if negative feelings are associated with it, it can cause dissatisfaction with body image. And this is how Stokes and Frederick has in 2003 has defined it. Women with breast cancer undergo many undesirable body changes such as loss of hair, loss of breast, Poor physical and mental health causes changes in their thinking patterns, and this in turn adversely affects the quality of their life. Mastectomy presents them with a challenge to accept a new body image. So, studies have indicated a relationship between body image and psychological well being, and how psychological well being is being defined by Farrell, Doe, and Grant of breast cancer women. They defined the psychological well being of breast cancer patients in terms of their ability to cope with the disease, in terms of their ability to have control over their lives, in terms of their ability to remember, to concentrate, and to what extent they perceive themselves as happy and satisfied with their lives. So, there is a relationship, many studies have indicated, and as a teacher and a professor of psychology and researcher, I have supervised many researchers and quantitative researchers on this subject, which emphasize the impact of age on the body image and psychological well-being of breast cancer patients. The research which we conducted a decade back, 2003, indicated that young mastectomy breast cancer patients reported that their life is more boring, miserable, empty, disappointing, and discouraging than the middle-aged breast cancer patients. Then another student also conducted a study in 2012 and made a comparison between young and middle-aged mastectomy breast cancer patients. And surprisingly, the findings indicated that the young and middle-aged breast cancer patients showed less body concerns. This finding could be attributed to the social inhibitions which are placed on the women and which are being placed on the Pakistani women not to talk about and not to discuss their bodies. But the study indicated that the young and the middle-aged breast cancer patients who have been through mastectomy reported low psychological well-being, and they reported that they experienced low psychological well-being because of the difficulties in coping with the disease, because of the difficulties they faced in treatment, and they also reported that they are very, very fearful of recurrence of cancer, and they are fearful of spreading this cancer. Another study which we conducted in 2016 also showed the findings, the same findings with reference to psychological well-being, but the middle-aged mastectomy breast cancer patients reported body concerns. They reported body image concerns. They were concerned about their body image. So the findings of this research also indicated that education has a positive relationship with the body image and with the psychological well-being. Keeping in view the findings of these studies, and in the light of these findings, we can conclude that age, education, body image are the predictors of the psychological well-being. Today, using this platform as a professor of psychology and as a researcher, I would like to draw attention to some of the points. I would like to suggest that there is a need to develop indigenous skills rather than relying on the Western skills, although we can say that they are culture fair skills, and they have also been translated into Urdu, but there is a need to develop indigenous skills for measuring body image and psychological well-being of breast cancer patients, and these indigenous measures can provide better insight about the subject. There is a need to make breast cancer patients understand that sometimes very good, very nice people have to take the difficult exams in life. There is a need to make the breast cancer patients realize they are not being valued because of their bodies, but they are being valued because of their beautiful souls and their abilities. I would suggest that the study circles with educated breast cancer patients can also help them to cope with their disease. Clinical psychologists for sure can help them to change their cognitions and perceptions about their body image, and this in turn can enhance their psychological well-being. I would suggest that media can play a very important role by having programs on breast cancer survivors, and these programs can help the patients to cope and combat with this disease effectively. I feel that awareness campaigns at college and university level are much needed. And in the end, I would like to suggest that the memorandum of understanding or memorandum of collaboration between health sector and the educational sector can contribute in terms of awareness campaigns, awareness seminars, research, internships, indigenous skills, psychological assessments, and interventions. And with this, I end my talk. Thank you ever so much for giving me an opportunity to share my views on the subject of body image and psychological well-being. Thank you.
Thank you so much, Professor Dr. Salma Hassan. With immense gratitude, I would like to invite Dr. Fatima Kamran, Associate Professor at Institute of Applied Psychology, University of the Punjab, Lahore. Dr. Fatima is an eminent scholar and academician in the field of psychology with more than 20 years of teaching experience. She has her PhD and postdoc from University of Surrey, UK. Over to you, ma'am. Sorry to interrupt you, Dr. Fatima, but we cannot hear you. No, ma'am. Dr. Fatima, can you please rejoin us? Maybe this problem will. Thank you.
Can you hear me now?
Yes, ma'am, you are audible. Thank you so much for
Okay, I'm
rejoining.
joining by my phone now. Okay, thank
Thank
you
you so much.
for having me here. And this is a great initiative, and I must appreciate this initiative taken by RLMC. And I would really like to thank my mentor, Professor Dr. Nashi Khan, for inviting me. And I have been hearing live streaming aapki chal rahi thi, the speakers who have been talking and highlighting some of the very important and major issues faced by the breast cancer survivors. I would like to highlight a few things from the perspective of a clinical health psychologist. First of all, in Pakistan, most of the people think the psychological issues are taken care of by a psychiatrist or a psychologist, a clinical psychologist. But recently, the newer developments are that health psychology is being recognized as a very major and important area, because in health psychology we tend to work with people having chronic conditions, terminal conditions, physical conditions, not only the psychiatric problem. So it's very important that people should know who is a health psychologist and what can we do for people who are living with such chronic conditions, and some of them are life threatening, and they have to live on a lifelong basis with these conditions, and cancer, being a cancer survivor, is one of them. So, a health psychologist is basically a person who would deal with the psychological consequences of a physical condition, or like diabetes, hypertension, or any other. And if you're talking about specifically breast cancer, they have to alter their lifestyles, they have to work on themselves, and they have to move in a society, cope with the challenges. And the aim is to provide them a chance to maximize their quality of life. So, being a health psychologist, my aim working with such survivors or patients who are going through their chemos or radiotherapy is to support them psychologically so that they can cope well, they can take the challenges, they can take the burden, and they can move on and adjust to the altered lifestyles, so that once they are through this process and they resolve their conflicts, all the psychological consequences, such as I think it has been talked about, they tend to have a poor body image or depression or anxiety or whatever, like family issues, relationships, because cancer is a kind of thing which not only taxes you physiologically but psychologically. And the word cancer is like, it is quite devastating for people, and there is very less awareness regarding this thing, that not all cancers are deadly. So we need to guide the person going through this, the family, what are the expectations that a person might have, because doctors definitely don't have that much of time. So I feel that in the treatment protocol or in the follow up protocol, the clinical or health psychologist should be a part of the team, so that the psychological consequences and concerns of the family, of the person, are taken care of. स्पेसिफिकली अगर हम बात करते हैं कि जी लोगों को क्या पता है ब्रेस्ट कैंसर के बारे में, और वो सिर्फ इसको एसोसिएट करते हैं, जैसे अवेयरनेस कैंपेन्स हो रही हैं, और वो हम हेल्थ साइकोलॉजी, I'm basically running this program of MS in health psychology, and I'm the coordinator. So my aim is to highlight and develop more awareness about breast cancer, which is rising at an alarming stage. लोगों को एक कॉन्सेप्ट बेसिकली होता है कि इफ देयर इज अ लंप इन द ब्रेस्ट और इफ देयर आर सिम्टम्स लाइक पेनलेस लम्प्स हैं, तो हम लोग उनके कुछ मिथ्स भी जो हैं वो क्लैरिफाई कर सकते हैं. समटाइम्स देयर इज एब्सोल्युटली नथिंग. And my interest in breast cancer and breast cancer survivor, their quality of life grew more after my sister was diagnosed with breast cancer, and she had her treatment in Switzerland, Geneva, and I was following the protocol they are given there, and how much concern do they show about the self-esteem, body image, the psychological needs of the patient, which was really remarkable. And I hope and I wish and I am contributing my level best that we can adopt the same protocols here in Pakistan as well. So the journey my sister and we as a family and me as a health psychologist we have been through was I think facilitated by the healthcare team involving the physicians, the surgeons, and the health psychologists, who have paved the way and prepared us. And now, even now, the guidance is there and they are working on the issues. So we basically work on how they can maximize their quality of life, because the main issue is that the relationships, the meaning in life, once you are diagnosed with cancer, the person all the times thinks that now it might be the end of anything or everything. Like a layman, if I think like a layman, Like it can be the end of my life, or what will happen, this and that. So fears, anxieties, uh, apprehensions, worries, everything is there. But when they lose meaning in life, they have nothing to look forward to. That is the major thing that needs to be identified. What are the reinforcers in their life? What is there in them? Is it faith? Is it their families, their loved ones, for whom the patient should struggle and become a survivor? Because we don't really encourage using the term cancer patient. We would say individuals with cancer. We don't label, we don't stigmatize. And cancer survivor are warriors. They are warriors, and they have been through a war and they have won it. So we must encourage these people to go on and never give up, because the time when a person gives up because of the extreme negative and adverse uh, side effects of the medications, that is where the role of a clinical health psychologist comes in. And we should be working there to provide not only support to the individual but to the family. Sometimes we undermine and we take the family for granted, who are going through the same. Sometimes the family is going through a distress even more than the patient. The patient obviously is suffering in pain, the physical pain and the psychological pain, but the pain the family, the loved ones, the relationships they are going through is cannot be undermined less than that. So I think the meaning in life should be restored by making them realize that there are things, and this is not the end of the world. We have to work on their cognitions, their belief system, and identify what are their health beliefs, what are their illness perceptions. Because the way, and that will depend on definitely the socio demographic factors, which are very important. And we cannot have a same type of plan, therapeutic plan or management plan for all the patients going through this, because every person is unique, every person is individual with different life circumstances. So according to the demographic background of the person, we need to customize intervention plans, support groups, and help them out to continue life and maximize their life. The problem is that they have to indulge into a kind of response shift. This is this theory of response shift, which is really very interesting. That naturally, God has gifted us with an ability to adapt, to ability to change and move on and accept. But with the help of a professional, a clinical psychologist, a health psychologist, we help patients to discover themselves, to discover the potential they have, and how can they move from this self to another self, and even value life and themselves and relationships and everything more than they used to. क्योंकि जब तक एक चीज आपसे लूज होती है तो फिर आपको उसकी कदर ज्यादा आती है. हम अपनी हेल्थ को अक्सर बहुत फॉर ग्रांटेड लेते हैं कि इट्स ओके, कि अगर वी कैन ब्रीथ, वी कैन ड्रिंक वाटर, वी कैन डू दिस, वी कैन डू दैट. Once we are struck by a condition which can be deadly, which can be life threatening, everything changes. Everything changes. And there comes a point when you realize that a single step, a single gesture can change the consequences for me. So we need to be very empathetic, and we need to be very careful about how things might affect. For example, giving a diagnosis. When the doctors disclose or have to share the reports, the results of the reports, and the person is detected with the cancer, it is not that easy, because it cannot be taken uh, easily by everyone. Some people might be strong, some people might appear to be strong, but there is a need to guide our even health professionals how to give a diagnosis, how to comfort the patient, how to have a good doctor patient relationship. These are the domains which we health psychologists really focus on. What are the perceptions of the person, of the client? How is the person perceiving his or her condition? And what kind of doctor patient relationship do they have? Do they have trust in their doctor? Do they have faith in their doctor? Do they have treatment satisfaction? Because once this relationship is smooth, once the person has full trust in the doctor, then the journey further becomes quite manageable. So for that, the characteristics of the doctors, the time, the quality time the doctor gives to the patient, the way you talk to the family, the way you show your concern is very important. So for our trainees of clinical psychology, for health psychology, we should guide our trainees how to deal with these individuals, their families, and make them understand that we are there for them. They are not alone in this misery, and which is not that easy. So being empathetic, it, the word empathy looks very small, but it is a very big thing. And I think doctors who have personal experiences, like a family member going through the same, can relate more to the agony, to the misery of such people who are there and who are just looking towards the doctors and finding hope. So dealing with their hopelessness, हमने उनको अनरियलिस्टिक एक्सपेक्टेशंस डेफिनेटली नहीं देनी होती, लेकिन ये कि हमने उनको होपलेस भी नहीं होने देना. हमने उनको जो सोशल स्टिग्मा है, बहुत सी चीज़ें हैं, अगर हम साइकोलॉजिकल कॉन्सेप्ट्स की बात करते हैं जो हमारी सोसाइटी में होता है कि लोग यहाँ पे कैंसर को, बीमारी को, किसी का रीनल फेलियर है, किसी का कोई कार्डियक प्रॉब्लम है, लोग बीमारियों को यहाँ पे एक स्टिग्मा की तरफ लेते हैं. स्पेशली खासतौर पे अगर हम ब्रेस्ट कैंसर की बात करते हैं, हम इसी पे फोकस करें, तो इसके साथ जैसे बॉडी इमेज कंसर्न्स आते हैं, तो अपीयरेंस रिलेटेड इश्यूज इतने सिवियर हो जाते हैं कि कई दफ़ा वो एक इंसान की, एक औरत की खास तौर पे जो मैरिड लाइफ है, जो उसकी प्रोफेशनल लाइफ है, जो उसका सेल्फ इमेज है, इन सारी चीज़ों को डेफिनेटली नेगेटिवली इफेक्ट करते हैं. सो उसकी सेल्फ एस्टीम, उसका बॉडी इमेज, उसकी सेल्फ वर्थ, उसकी क्या फीलिंग्स है, इसके लिए शी नीड्स टू कम्युनिकेट ओपनली. सो एक जो वार्मथ रिलेशनशिप में होती है, एक किसी प्रोफेशनल से आप बात करें, घर वालों की सपोर्ट इज देयर और नॉट देयर, वो एक अलग चीज़ है, लेकिन एक आपको जो प्रोफेशनल से, एक डॉक्टर से, एक साइकोलॉजिस्ट से जो सपोर्ट मिलती है, वो एक इंसान को बहुत स्ट्रॉन्ग बना सकती है, और वो ही बहुत इम्पॉर्टेंट है और जिसके ऊपर हमें काम करने की ज़रूरत है. वंस द पेशेंट गोज थ्रू दिस प्रोसेस ऑफ कीमो एंड रेडिएशन एंड रेडियोथेरेपी, और वो फिर हार्मोनल थेरेपी पे आते हैं, उसके बाद लाइफ के चैलेंजेस क्या हैं, क्या चेंजेस आती हैं, कैसे उनको डील करना है, डाइटरी प्लान क्या होता है, डाइट के क्या चेंजेस हैं, वो गाइड करना एक हेल्थ साइकोलॉजिस्ट का काम है कि उनको बताया जाए कि उनके लिए क्या चीज़ें हैं. हमारे यहाँ हर इंसान को ये अवेयरनेस नहीं होती. जो पढ़े लिखे लोग हैं वो तो देख लेंगे, वो पढ़ भी लेंगे, वो देख भी लेंगे, वो पूछ भी लेंगे, क्वेश्चन भी कर लेंगे, लेकिन हमारे यहाँ बहुत से तबके ऐसे हैं जिनमें ना तो ये अवेयरनेस होती है, ना उनको इसकी इम्पोर्टेंस का पता होता है. तो डेवलपिंग appropriate suitable diet plan for them, उनके लाइफस्टाइल, उनके अगर सेडेंटरी लाइफस्टाइल्स हैं तो उनको बताना कि क्या चीज़ें उनके लिए इफेक्टिव हो सकती हैं, ताकि उनकी जो क्वालिटी ऑफ लाइफ है उसके अंदर, उनके साइकोलॉजिकल वेलबींग पे तो हम काम करते ही करते हैं, लेकिन उनका फिजियोलॉजिकल वेलबींग भी हमारा एक बहुत इंपॉर्टेंट डोमेन होता है जिसके ऊपर हमें फोकस करने की बहुत ज़रूरत होती है. तो जो भी ये सारी इंफॉर्मेशन है, एक आम इंसान के लेवल पे आकर उसके साथ डील करके उसको बताना कि जी क्या आपके लिए बेहतर है, क्या नहीं है, आपको किन चीज़ों के ऊपर मॉनिटर करना है, आपने किन चीज़ों का ध्यान करना है, ये चीज़ें हमारी आम लोगों को पता होना बहुत ज़रूरी है. और उसके लिए हमें बहुत ज़्यादा अवेयरनेस, जैसे ये आप लोग इस तरह सेमिनार करें, दिस इज़ वन ऑफ द स्टेप्स टुवर्ड्स दिस अवेयरनेस कैंपेन. सो इट इज़ वेरी इंपॉर्टेंट दैट वी फोकस ऑन दीज इशूज़. और स्पेशली ख़ास तौर पे मैरिड लाइफ जो है उसके ऊपर बात करने की बहुत ज़रूरत है, जो कि हमारे यहाँ टैबूड एरिया है कि हर एक उसके ऊपर खुल के बात नहीं कर सकता. तो वहाँ पे फीमेल क्लिनिकल साइकोलॉजिस्ट की और फीमेल हेल्थ साइकोलॉजिस्ट की बहुत कंट्रीब्यूशन हो सकती है in talking to the couples, in improving their marital satisfaction, and in improving their medication adherence. मेडिकेशन एडहेरेंस बहुत इंपॉर्टेंट है, ताकि कई दफ़ा लोग एक दफ़ा ठीक हो जाते हैं तो वो समझते हैं कि बस अब आई एम थ्रू दिस, एंड इवन इफ आई कंप्लाई और डोंट कंप्लाई, आई एम फाइन. So we need to identify these target areas like doctor-patient relationship, what are their illness perceptions, what are their health beliefs, how important it is to adhere to your medication on a lifelong basis. Short-term adherence is easy, but long-term um, adapting and acceptance and compliance is not that easy. So we need to work on these area, and discovering what are their goals and meanings in life. तो लाइफ को मीनिंगफुल बनाना है, छोटे छोटे गोल्स, शॉर्ट टर्म गोल्स, उनका लेवल ऑफ फ्रस्ट्रेशन टॉलरेंस, ये सारी चीज़ें जो हम डील करते हैं जब ब्रेस्ट कैंसर सर्वाइवर्स हमारे पास आते हैं और हम लोग उनको हेल्थ कंसल्टेशन देते हैं, एंड वी सी अ पॉजिटिव चेंज इन दैम. They go and they report later on that yes, it does make a difference when we change our cognitions. जब हम उनकी cognitive restructuring करते हैं, हम उनको लाइफ की दूसरी साइड पे दिखाते हैं that at least breast cancer is a type of cancer which has 100% prognosis of getting better. So कैंसर से डिप्रेस होने के बजाय उसके प्रोग्नोसिस पे गौर करने की बहुत ज़रूरत है, और ये पॉजिटिव एस्पेक्ट्स हैं जो हाईलाइट करने की और पेशेंट को होप देने की बहुत ज़रूरत है. I think this is what I would like to highlight as a health psychologist. So I hope this can be understood. What are the major domains? What do we do? And there has to be a job for a health psychologist besides a clinical psychologist in all units of the hospital, so that whatever the condition is, there has to be a psychological consequence and there has to be a management for that. Thank you very much.
Thank you so much, Dr. Fatima Kamran. Now, again with immense pleasure, I would like to invite Dr. Mirad Gulbert, who is serving as a senior clinical psychologist, Department of Psychiatry and Behavioral Sciences in Mayo Hospital, Lahore. With her vast experience in the field of clinical practice, we are glad to hear her. Ma'am, over to you. The forum is yours.
Assalamu alaikum, and thanks for inviting me. Talking about breast cancer and the internal distress. It is indeed a very important topic in today's world, where most people go for the appearance of the people rather than the inner beauty of the person. And in our culture, whether you see the media, the poets, the storytellers, the drama artists, they portray a picture of a female full of glamour and full of the body image and body shape. Everything counts a lot. So whether a person, like being a clinical psychologist, whether a person is so much confident in her life, I mostly talk about female patients, because the ratio, the researchers which shows the ratios, female patients are most likely to have breast cancers in Pakistan. So I found that the people who are having diagnosed with breast cancers, they are more likely to have body shame. They have they try to hide things. The most the prominent thing is that they cover their heads, right, when they have started chemotherapy and other therapies. So the previous speakers very rightly said that we should encourage the support system, we should encourage the society, we should encourage the media to give a positive impact of empathy, nice words, nice gestures, the non-verbal communication. It all affects the sufferer. And it's not that everyone has an ability to express by words that whether they are really suffering from something. Sometimes they are just, building up the things in them. And it by itself, building things or suppressing or repressing the issues, the stress inside, it creates lots of psychological, psychiatric illnesses, as well as physical and medical illnesses. In our culture or in any culture, when a female is diagnosed with the breast cancer, it is a life devastating news for not only for her family too. And when I was preparing for this the points for this lecture, I was reading a few researches. One of the researchers said that concluded that the female, if she's married, her stress is very high unless and until the partner comforts her empathetically and provide a full support, the acceptance thing, their marital relationship, everything. The partner has to put a lot of effort to comfort the female. Then her internal distress could be managed. And when the female is single, then she has a lot more stress. Why? Because the source of acceptance or source of her femininity is being attacked by a medical illness, which is um, like very much important for her self-esteem, for her identity, and for self-acceptance too. Then another research was saying that it was seen that there was an inverse association between age and psychological distress in breast cancer patients. They said if the patient is young and they came to know about the disease, they become more sensitive, they become more hyper, they become more they face more psychiatric and psychological issues as compared to the people who have who are aged or who have been through a lot, who have experienced things, or the people who have seen their loved ones passing this illness. They started accepting it more, in a sound way as compared to the people who haven't seen any patient or haven't who have no knowledge about this illness. Psychological distress always increases the medical illnesses, whether it's a hypertensive thing, or diabetes, or of course cancer. Due to biopsychosocial stress of breast cancer, the affectees could develop psychiatric and psychological issues and illnesses. Of course, when they don't know how to cope with it and how to live a balanced and healthy life, they internalize the issue. They become more sensitive. Sometimes they make high hopes with other people around them, and sometimes they just have high hopes for themselves, and their goals of life and their way of living, it all got affected. Because a person who has suffered any medical illness, even a psychiatric illness, they have to live a life in which they have to not only change their thinking pattern, they have to change their eating habits, sleeping habits, their way of life. So to accept that, it's really difficult, and it takes a lot of time, energy, and commitment with themselves. And this is all the commitment, the energy, it's all internal. If a person has a willpower, a commitment to one's own self, they can fight these diseases. Because I have been through Shaukat Khanam for our research, and I have seen that there are patients to whom the doctors have said that we are going to discharge the patient because there's no more time left for the patient and they should spend the time with their family. But the patient was so much willing to live a healthy life. They want to beat their internal stress and they want to live a quality life. They lived for years after that. Strong internal distress is found when the person has much problems and responsibilities or major negative life events which affects their illness more. Another research proved that if sometimes due to a lot of stress the pent up stress, the piled up stress create medical illnesses. And one of them is, of course, after hypertension and diabetes, it's cancer and various other diseases. There is a difference in internal distress. It is found in recently diagnosed patient distress in distress of patients who have family histories, which I've already discussed. That because they have seen that their family members or the people who has coped with those things, and if they are successful in adjusting and living a healthy life, they can follow those particular lines or principles, and they can spend their life according to those rules. When a person was recently diagnosed, the first thing which the first reaction is the shock, because we are not ready. We all know that we are going to die one day, but we are not prepared for any disaster, any shock in our life. Although we all know that life is not like a monotonous thing. We have up and down in our life, but life threatening diseases are always shocking for anyone. So if the person hear the bad news, the first reaction is shock, which is called the initial paralysis, because we are not ready or prepared for that. Whether any patient whose family is suffering from these diseases, still they are not prepared for that. They think that, okay, if any one of my family member has been affected with that disease, it doesn't mean that I am also going to be affected like that. But the probability, the chances increases always. After shock, the other thing is denial. And this whole process is really an internal thing which increases our distress, because first we are in a shock, we are not prepared, then we are in a denial, we continuously fight within ourselves, we are not adjusting, we are just we are internally that much disturbed that sometimes we don't get the treatment, or sometimes we don't want to do it, we don't want to follow the guidelines of our physician or our family members, because we just want to prove that we are okay. It could not be happened to us because we have done a lot of things. And sometimes when the denial is broken, we end up into anger, because then we become helpless, and it was like obvious, or it was clear to us that yes, it's we cannot do anything. And the anger is also a reaction of hurt and helplessness. So it's another form of our internal distress. Then the other phase is bargaining, in which we try to just calm ourselves down. We try to look for the people who are also who has also suffered from this disease, and then we just try to calm ourselves down that the other people are also suffering from this disease, and we try to normalize ourselves. We try to be more into normal stream. Sometimes we try to encourage ourselves, but still we are the person who is who is a sufferer is not that much able to face the world, to face the reality, because these sort of serious and emotional illnesses, I always say that hypertension, diabetes, even liver issues, HIV, cancer, these are all the medical illnesses, but they're turned into emotional and end up into psychological illnesses, and afterwards psychiatric ones, because it's a vicious circle unless and until they're they're not recovered. Like, they're not the things which, it's not like a fever that if it happens once, then you just take a Panadol and you're recovered. So it's a life changing disease, it's a life changing illness. After that, when you start bargaining, you feel more, like the person who is suffering from that feel more hopeless and feel more um, targeted, or maybe somehow I find that researchers also said that if at that stage the person started having self pity, because it's another form of internal distress, and if they started having self pity, then they went into depression. And why? Because they cannot bargain. The bargaining is a continuous process, but they are not ending up into a win-win situation. In this bargaining, they have to submit, they have to admit. And after that, they start, when they are in a depression, the social support has less influence, because researchers said that if the internal distress is high, even strong social support does not work. The person has to stand up, the person has to bear, the person has to be resilient, be strong from within, because it's an internal distress, and we have to compete the internal distress through our own willingness, through our own resilience. After the phase of this fight within ourselves, when we get tired, when we realize that yes, it happened, then we start testing things. You know, we seek for the solutions. And when we start seeking for the solutions, seeking for help, then the stage of acceptance started. And this is the ultimate stage in which our internal distress could be calmed down, could be managed. Then we can seek psychiatric, psychological help too. But first, initially, and it's a very must for the patient to seek psychological help, because when their lifestyle change, their thinking pattern change, they can manage and they can get along well with this illness, because it's a life changing illness. And acceptance is a way forward. So with acceptance, and the research also says that when acceptance became high, the resilience became more high. When you accept, you become more resilient. If you accept positively that yes, I accepted that this thing happened, now I have to face it and move on, then you become more resilient. And when you become more resilient, you can fight with any sort of internal distress. You can cover it up, you can manage it. I'm not saying that you are going to recover and there will be no internal distress in your life, but you can manage it, fight with it. Thank you.
Thank you so much, Dr. Mirat, for such an important talk. Living with a cancer patient as a caregiver is itself a lifelong learning, painful experience, and we are honored to have a personality with us today to share her views. With immense gratitude, I would like to invite Ms. Sharmeen Tarer, renowned consultant speech therapist, clinical linguist, and speech language pathologist. Ms. Sharmeen Tarer is trained from London, UK. Over to you, madam. The forum is yours.
Thank you for having me. I've been listening to the conversation and by all these colleagues and the consultants. Being a caregiver, I was being a daughter as a caregiver. Um, I was with my mother along with my siblings for whole 8 years. My mother was diagnosed with cancer when she was 54. Now at the age of 59, I can imagine 54 is no age. The type of cancer she had was very bad, and we were told that perhaps there are only a few years, 2 to 3 years, she'll survive. My mother had a very strong and a very positive personality. So taking care of her was perhaps like looking around and seeing different cancer patients, I can see perhaps was not as challenging for us as we see around. She was an educated woman. She would herself look into the reports and have discussions with her doctors. Uh, having being someone from the middle upper class, um, money was not as such an issue. But I still remember she came back from an oncologist and she said कि डॉक्टर साहिबा ने मेरे से पूछा है कि आपकी कीमोथेरेपीज होंगी और आपके मियाँ के पास क्या करते हैं, उनके इतने वसाइल हैं. मेरी माँ का ख्याल ये बड़ा ब्लंट सा सवाल था. पैसे हों या ना हों, जब कैंसर हो तो लोग इलाज के ऊपर लगाते हैं. तो I could see how she would react to the doctors, the discussions with them, their conduct, which doctors need to be very careful, and even a very bad news they need to give very politely. Ma'am, I would like to say a few examples from my mother's, how she would, how she saw her problem and she perhaps internalized it. Being a speech language pathologist, I would call it कि जो verbatim analysis है मरीज का, भले उसका आपसे करीब तरीन रिश्ता ही हो या आप एज अ स्पीच थेरेपिस्ट काम कर रहे हों, जैसे कि मैं कई दफ़ा कैंसर के पेशेंट जो लरिंजियल कैंसर होता है उनके साथ काम करते हैं. तो क्लाइंट का और ख़ास तौर पर जो आप एज अ केयर गिवर, आप इफ़ यू आर अराउंड, दैट वर्बेटम is very important and its analysis can give you so much insight कि जो मरीज़ है वो रोज़मर्रा ज़िंदगी में क्या महसूस कर रहा है और एट अ लार्जर लेवल उनकी ज़िंदगी के बारे में परसेप्शन क्या है. My mother apparently was a very strong woman, लेकिन मुझे याद है कि वो घर का हिसाब किताब जिस डायरी पे लिखा करती थी, वो एक दिन मैंने खोली तो उसके ऊपर एक शेर लिखा हुआ था जो कि एक और राइटर औरत का था, मुझे उनका नाम याद नहीं, जो कि खुद कैंसर पेशेंट थी. और वो शेर का मुझे उसका एक मतलब मुझे याद है, जिसका जो ये था कि मैं अल्लाह की बहुत शुक्रगुजार हूँ कि उसने मुझे ज़मीन के ऊपर रखा हुआ है और मैं ज़मीन के अंदर नहीं गई, क्योंकि जब मैं ज़मीन के नीचे चली जाऊँ तो मेरा अपने सारे प्यारों से जो दुनिया वाला ताल्लुक़ है वो कट जाएगा. उस दिन मुझे एज अ केयर गिवर, क्योंकि आई वॉज अ डॉटर एज वेल, तो मुझे लगता था कि शायद ये सिर्फ हमारी पेन है कि एक दिन खुदा न खास्ता हमारी वालदा ने चले जाना है, सभी ने चले जाना है, लेकिन जैसे कि इस तरह की बीमारियों में आप और खौफज़दा होते हैं. तो मुझे उस दिन महसूस हुआ कि उन्हें भी यही खौफ, उन्हें भी यही उदासी है कि मैं जब चली जाऊंगी तो मैं अपने बच्चों से दूर हो जाऊंगी. इसी तरह मुझे याद है कि हम अपने वफात से साल डेढ़ साल पहले उन्होंने कहा कि मैंने मेरी बुकिंग करवाएं किसी स्टूडियो में, मैंने अपनी तस्वीर खिंचवानी है. शी वॉज अ वेरी वेल ड्रेस्ड, वेरी ब्यूटीफुल वुमन. तो हर सेल्फ परसेप्शन वॉज टोटली डिफरेंट. तो हमने कहा कि मैं अपनी अच्छी सी तस्वीर खिंचवाना चाहती हूँ. मैं नहीं चाहती कि मेरे बाद मेरी पुरानी अजीबोगरीब तस्वीरें पुराने ज़माने की लुक वाली लोग लगाते अपने घरों में मेरे फ्रेंड्स और रिलेटिव्स रखें. तो हर इंसान जो है वो अपनी बीमारी को डिफरेंट तरह देखता है, और कैंसर के पेशेंट हवाले, रिलेटिव के हवाले से तो हमारे लिए ये समझना भी ज़रूरी है कि उनकी अपनी पहले पर्सनैलिटी क्या थी, और उस पर्सनैलिटी के को सामने रखते हुए वी नीड टू कम्युनिकेट विद हर, टू गिव हर रीअश्योरेंस. और देखिए, इट्स वेरी इम्पॉर्टेंट फॉर द केयर गिवर कि वो हमें उसकी अपनी वेल बीइंग भी इसलिए इम्पॉर्टेंट है कि कई दफ़ा जब आप एज अ चाइल्ड डिप्रेस्ड हैं और खौफज़दा हैं, तो मुझे याद है कि उनकी कीमो होनी थी और आई वेंट विद हर अलॉन्ग विद माय ब्रदर. تو انہوں نے جب ڈاکٹر نے آ کر کچھ بتایا کہ مجھے لگ رہا ہے یہ تھوڑا سا اور بڑھ رہا ہے، تو انہوں نے میرے چہرے کی طرف دیکھا اور انہوں نے ہنس کر میری ماں نے کہا کہ میں اجے اتھے ہی ہاں، میں نے کچھ نہیں ہویا. تو for a second person or the third person who is a caretaker is very different from as a child. اللہ تعالیٰ کسی کے گھر میں یہ بیماری نہ رکھے، لیکن یہ بیماری اب اتنی کامن ہے کہ جس گھر میں یہ ایک آزمائش بن کے آ گئی ہے، آپ کچھ نہیں کر سکتے، لیکن آپ اپنا وقت اپنے پیارے کے ساتھ گزار سکتے ہیں، کیونکہ دیٹ ٹائم از ویری پریشس. اور مریض کے لیے یہ ری ایشورنس ہی بہت ہے کہ آپ قریب ترین رشتے جو ہیں وہ ان کے پاس ہیں. ہاں، یہ بھی اللہ تعالیٰ کی ایک نعمت ہے کہ آپ کے پاس نرسز ہوں، آپ کیئر ٹیکرز ہائر کر سکتے ہوں. لیکن میرا ایکسپیرینس یہ ہے دوسرے مریضوں کے پاس جانے کے بعد بھی کہ the patient they cherish most their relatives، جو ان کے قریب ترین کے رشتے ہیں ان کے پاس ہونا سب سے زیادہ ضروری ہے. وہ جو فیسلٹیز ہیں ان کی کمی بیشی بھی ہو تو وہ اس سے وہ اس کو اوور کم کر لیتا ہے. اور میں چاہوں گی کہ ہم تمام لوگ جن کے گھروں میں یہ بیماری ہے یا جو اس طرح کے مریضوں کے ساتھ ایز اے پروفیشنل بھی اسپینڈ ٹائم، کہ ہم انہیں اپنی دعاؤں میں یاد رکھیں اور ان کی خوبیوں کو یاد کرتے رہیں. یہی وہ چیز ہے. اور انہوں نے اپنی بیماری کو جس طرح اس میں سے گزرے اور اس کو ہینڈل کیا، اس پازیٹیوٹی کو کبھی نہ بھولیں. اور بطور مسلمان ہمارا ایمان بھی ہے ہر ایک کی موت کا ایک وقت مقرر ہے اور اس نے کس طرح جانا ہے اس پر ہمارا کوئی اختیار نہیں. لیکن the least we can do as a family, as a caregiver, is to give time, to give support, to be available. میں بس یہی کہنا چاہوں گی. اور وہ جو کہتے ہیں ان کا جو وربیٹم ہے، ان کا جو نیریٹو ہے چیزوں کے بارے میں نیریٹو ہے، اس کے اوپر ضرور دھیان کریں. کئی دفعہ مجھے یاد ہے کہ زلزلہ آیا اور کوئی ارتھ کوئک تھا اور جھٹکے جب لگے تو ہم اوپر والی سٹوری میں تو ہم سب نیچے کو بھاگے. تو میں نے اپنی امی سے کہا کہ تو سنی چلنا، تو انہوں نے ہنس کے کہا کہ میں تے اونج بھی ٹر جانا ہے تے اے نہ ہوئے کہ کوئی لاتبا سیڑھیاں بنا لواں. تو so she would at times her words, her sentences, she used to say to my nephews کہ جب یہ بڑے ہوں گے کی شادی ہوگی وہ میں تو نہیں ہوں گی. بس ہمیں ان کا دھیان رکھنا چاہیے. she died 20 years back، لیکن اب دیکھیں کہ یہ بیماری، اس کی تکلیف، اس کی سفرنگ، اس کا جرنی اتنا سخت ہے کہ آپ when you go back into that time you feel کہ شاید آپ دوبارہ اس میں سے گزر رہے ہیں. تھینک یو.
Thank you so much, Ms. Sharmeen, for the talk and sharing your personal journey with us. Now, I would like to invite a dynamic professional beauty consultant, ex-country coordinator of Diplex Smile Again Foundation, ex-general manager, New Look Beauty Spa, Ms. Ushna Khan, who is currently working as managing director at renowned Hadika Kyani Salon and Franchise. We will be hearing her views about as a caregiver. Over to you, ma'am.
Assalamu alaikum. Can you hear me? I
Yes,
hope all of
ma'am.
you are hearing me.
Yes, Ms.
Thank
Ushna,
you.
we can hear you. Thank you.
Thank you so much. سب سے پہلے تو میں آپ سب کا شکریہ کروں گی کہ آپ لوگوں نے مجھے بلایا. السلام علیکم. اور مجھے اس سیمینار میں بات کرنے کا موقع دیا. کینسر اور کینسر سے ریلیٹڈ جتنی بھی ریلیٹڈ پرابلمس ہیں میں اس سے بالکل انویئر تھی, بیکاز میری ایک فیلڈ ایسی ہے دیٹ از میئرلی ریلیٹڈ ٹو بیوٹی اینڈ میکنگ پیپل بیوٹیفل اینڈ آل دیٹ. اور کینسر نام کا کوئی فیئر میں نے کبھی فیس نہیں کیا تھا. بٹ ون سڈنلی my very dear, my khala, she is just like my mother. When she was diagnosed with metastatic carcinoma, تو مجھے ایسے لگا جیسے ہمارے سر کے اوپر کوئی پہاڑ سا ٹوٹ گیا. اور بینگ اے کیئر گیور, آپ کبھی کبھی بہت مضبوط رہ کے بہت زیادہ کمزور بھی ہو جاتے ہیں. اور اس مومنٹ پہ مجھے سب سے زیادہ, مجھے پرسنلی خود سے یہ محسوس ہوا کہ ایک سائیکالوجسٹ کی اوپر جب ایسا پرابلم آیا تو ہمارے پاس کوئی ایسی سپورٹ نہیں تھی کہ ہم ان کو اور میرے جیسے اور کیئر گیورز جو ہوں گے جن کو یہ ایک ڈیتھ سینٹینس کی طرح سے محسوس ہوا کہ اب ہمیں پتہ نہیں کیا کرنا ہے. 4th اسٹیج بتائی گئی اور 2 months دیے گئے ڈاکٹرز کی طرف سے, اینڈ اٹ واز more like that she is wrapping up from this world. That was a very, very difficult phase in my life. Obviously, it was the hardest part of her life also. She was a very, very devoted professional person in the field of, you all know her very well, in psychology, and she has been a big support to most of the people who ever dependent on her. بٹ جب ان کو یہ ہوا اور میرے لیے سمجھ نہیں آتی تھی کہ ہم کس سے بات کریں, کس سے پوچھیں. ہم ویب سائٹس کھول لیتے تھے اور ہم پروگنوسس دیکھتے تھے اور ہمیں سمجھ نہیں آتا تھا کہ ہم کس کو, کون ایسا ہمارے پاس ایسا کوئی سینٹر ہو, کوئی ایسی سپورٹ سسٹم ہو, کوئی جتنے بھی یہاں پر پرائیویٹ ہاسپٹلس ہیں جہاں پہ پیشنٹس آتے ہیں تو کوئی بھی ایسا سپورٹ ہمیں نہیں مل رہا تھا. Initially, first 2 weeks, she was very upset. Obviously, she was seeing that something that was not ever planned. آپ کی زندگی میں ایک اتنا بڑا ایک طرح کا سونامی آ جاتا ہے اور آپ اس کو نہیں ڈیل کر پاتے کہ کس طرح کرنا ہے. بٹ ہماری فیملی نے ڈیسائیڈ کیا کہ وی ول گوئنگ ٹو ٹیک ہر ٹو رائل مارسٹن ہاسپٹل, لنڈن. That is considered to be one of the best hospitals for cancer treatments. But my khala simply refused and she said that agar Allah ne mujhe zindagi deni hai to kahin bhi dega. اور میں نے اپنوں میں یہ ابھی سب اسپیکرز نے جو بات کی, that is very true, that along with chemotherapy, along with the treatments, the most important thing is love, care, respect, and the spirit to make that person realize that she is very important to the family, way more important than جتنا وہ سمجھتے ہیں. کیونکہ کسی کو پیار دیا جاتا ہے نا تو اس کی جو ہمارا بیسیکلی جو تعلق ہے زندگیوں میں وہ ایک روح سے ہمارا تعلق ہے. بیکاز ونس وی ڈپارٹ فرام دس ورلڈ, ہماری جب روح نکل جاتی ہے دین وی آر نو بڈی, وی آر جسٹ باڈی. سو اگر آپ ان کی سول سے کنیکٹ کرتے ہیں اور سول کو انڈرسٹینڈ ہو جاتا ہے کہ یہ دے وانٹ می بیک, سو دیٹ پرسن ریئلی گیٹس دا energy to fight for this bad illness. اور میں سمجھتی ہوں کہ لو اینڈ سپورٹ ملٹی پلائز دس ٹریٹمنٹ کا افیکٹ جو ہوتا ہے وہ بہت اسٹرانگلی ہوتا ہے. اور میرا یہی کوشش ہوتی تھی کہ واٹ ایور شی سیز, واٹ ایور شی وانٹس, واٹ ایور شی وشز, دیٹ شوڈ بی brought into reality. She kept working. سب سے پہلی بات یہ ہے کہ کینسر سروائیورس کے لیے یا کینسر پیشنٹس جو اس وقت ہماری بات سن رہے ہیں, they should not feel hopeless, they should not leave their work. My khala kept on doing all what was her commitments with her students, with her work profession. She was working, she was even after taking the chemotherapy, she used to go to her office, she used to take vivas of her students, and I used to say کہ آپ کی immunity اتنی drop ہوئی ہوئی ہے, please don't do this to you. So she used to say کہ اگر میری زندگی ہے تو مجھے کچھ بھی نہیں ہوگا, بٹ میرے اسٹوڈنٹس کو سفر نہیں کرنا چاہیے. تو بیسیکلی یہ ہے کہ لائف کو اتنی بری طرح سے ایک ہٹ ہوتا ہے جب کینسر پتہ چلتا ہے ایک فیملی میں ہے, تو پوری فیملی جو ہے وہ شیک ہو جاتی ہے. اور اس بیماری میں یہ بھی ضرور پتہ چلتا ہے کہ آپ کے ساتھ کون ہے, اور آپ کے بہت سارے ایسے لوگ ہوتے ہیں جن کو آپ نارمل زندگی میں وہ آپ کے ساتھ اتنے ایکٹیو نہیں ہوتے, بٹ جب پتہ چلتا ہے کہ یہ بیماری آئی ہے تو وہ بہت کلوز ہو جاتے ہیں آپ کے, کیونکہ ناؤ اور دین ان کے دل میں آپ کے لیے جب محبت ہوتی ہے اور پیار ہوتا ہے تو وہ وقت ایسا ہوتا ہے کہ آپ کو سب سے زیادہ کینسر پیشنٹ کو سب سے زیادہ پیار, محبت, رسپیکٹ کی ضرورت ہوتی ہے, اینڈ پلس پروفیشنلی ایکٹیو ہونے کی بہت ضرورت ہوتی ہے. ہمارے پاس سائیکولوجیکل سپورٹ سسٹم اتنے نہیں ہیں, اور اگر کوئی ہیں بھی تو وہ اتنے ایکسپینسو ہیں, کیونکہ پرائیویٹ لوگ تو اس کو ضرور افورڈ بھی کر لیتے ہوں گے, کیونکہ جب فزیکل چینجز آتے ہیں ایک عورت کی زندگی میں, اور اس کی آپ یہ دیکھیں کہ فیمیل از فگر آف بیوٹی, اور آپ دیکھ لیں کہ سب سے پہلے بال, آئیز, آئی لیشز, آئی بروز اور اپیرنس, پھر کلر ٹونز چینج ہو جاتی ہیں کیمو تھراپی کے بعد, ریڈیشن کے بعد اسکارنگ ہو جاتی ہے, سرجری از ویری ویری پینفل. تو یہ ساری چیزیں جب ایک پیشنٹ کے ساتھ ہو رہی ہیں اور وہ اپنی لائف میں اپنے آپ کو بہت زیادہ ایسا فیل کر رہی ہے کہ آئی ایم ناٹ لائک دیم, تو وہ انفیریورٹی کمپلیکسز بھی اس کو ہو سکتے ہیں. آئی ایم شیور کہ بہت سارے ایسے لوگ ہوں گے جو اس بیماری کی وجہ سے جب ہیئر شیڈنگ سٹارٹ ہوتی ہے تو وہ لوگوں کو فیس نہیں کر سکتے ہوں گے, اور وہ بہت تکلیف دہ چیز ہے. میں نے سنا ہے کہ وہ اپنے گھر سے مررز اتار دیتے ہیں. تو because I'm in this field and I know that my khala used to have beautiful long hair that people used to ask her کہ ہم آپ کے بال جو ہے بہت خوبصورت ہے, آپ کیا کرتی ہیں ان کے لیے, and watching her losing her hair in bulks every day was a very painful thing for all of us, but especially I tried my level best to find human hair extensions that were really matching with her own hair tones. And I brought it one day to her and I said کہ خالہ آج آپ یہ پہنیں گی, اور آج کے بعد جب تک آپ کی کیمو تھراپی ہو رہی ہے اور جب تک پھر آپ کا اپنا ہیئر گروتھ ہو جائے گا تب تک آپ اس کو پہنیں گی. جو میں سمجھ رہی تھی کہ she will be very happy to have that and she'll praise me and she'll say all that کہ ہاں تم نے میرا خیال کیا. But she had such a strong faith, she had such a beautiful connection with Allah, and still she have that connection. And after this illness, I can see a very changed, very positive, very بیوٹیفل ہارٹ ان سائڈ ہر, کہ انہوں نے کہا کہ اشنا میرے اللہ نے جب مجھے اس طرح سے دیکھنا ہے تو میں کون ہوتی ہوں کہ میں ایک سر پہ وگ لگاؤں, نہیں, اینڈ آئی ایم بولڈ انف ٹو فیس دس اینڈ آئی ایم گوئنگ ٹو بی لائک دیٹ because my Allah wants this all happen to me, so don't worry, and I'm happy the way Allah will keep me. And she kept herself positive. میں تھوڑا سا ایسا انسان ہوں کہ میں تکلیف نہیں دیکھ سکتی, ان کی تو بالکل بھی نہیں, تو میں کبھی پریشان ان سے زیادہ ہو جاتی تھی. تو میں بتانا یہ چاہ رہی ہوں کہ یہاں پر سارے سائیکالوجسٹ ہیں آپ لوگ, کہ کیئر گیور کے لیے بھی سائیکولوجیکل سپورٹ سسٹم بہت ضروری ہے. پیشنٹ کے لیے تو ہے ہی ہے, بٹ کیئر گیورز میں مدرز بھی ہوتی ہوں گی جو اپنے بچوں کی کیمو تھراپیز کرا کے آتی ہوں گی, وہ کوئی ہسبینڈس کی کرا کے آتا ہوگا, کوئی بہن بھائیوں کی کرا کے آتا ہوگا, اور اس کے بعد اپنی کیمو تھراپی از اٹ سیلف ویری پینفل تھنگ, کہ ایک طرف تو وہ ٹریٹمنٹ ہے, دوسری طرف اس کے سائڈ افیکٹس اتنے ڈراسٹک ہیں کہ اینی تھنگ کین ہیپن اینی ٹائم, گاڈ فاربڈ. بٹ اللہ نے میریکل کیا ہمارے لیے, اور ہم لوگوں نے خالہ نے تقریباً 2 سال کے قریب اس بیماری سے فائٹ کیا اور ناؤ شی از الحمد للہ آل کینسر کلیئر. اور ان کا سیکنڈ پیٹ اسکین بھی جب ہوا تو میری بہت جان نکلی ہوئی تھی، کیونکہ ڈاکٹرز اس بیماری کے بعد کبھی بھی یہ نہیں کہتے کہ یور پیشنٹ از کلیئر فرام کینسر. دے آلویز سے دیٹ اٹس ان ریمیشن اسٹیٹ. تو الحمد للہ ان کا پیٹ بھی بالکل الحمد للہ کلیئر آیا ہے. سو آئی ایم آن ان فیو لکی پیپل جن کے کینسر فائٹر کو اللہ تعالیٰ نے صحت دی. بہت سارے ایسے لوگ ہیں جن کی جرنی یہاں ختم نہیں ہوتی، جو اس دنیا سے جن کے پیارے یہ چلے جاتے ہیں، اور ان کے لیے کینسر نام ایک بہت بھیانک ارتھ کوئک کا نام ہے، ایک بہت بھیانک والکینو کا نام ہے جو ان کی زندگیوں کو ایک طرح سے ڈسٹروائے کر کے چلا جاتا ہے. تو میں آپ سب لوگوں سے یہی ریکویسٹ کروں گی ایز اے کیئر گیور کہ پیار، اتنا پیار کہ انہوں نے کبھی سوچا نہ ہو، اور اتنی عزت، اتنی رسپیکٹ، اتنی کنیکٹیوٹی ان کی سول کے ساتھ رکھیں، اور انہیں بتائیں کہ وہ اس کو بہت ایزیلی فائٹ کر لیں گے. کیونکہ ہر چیز، بیٹل جو ہے وہ انرجی سے ون ہوتی ہے، بیٹل جو ہے وہ سپورٹ سے ون ہوتی ہے، بیٹل جو ہے وہ اللہ کی مہربانی سے ون ہوتی ہے. سو آئی ایم ویری مچ پراؤڈ بیکاز کیئر گیورز ایموشنلی، فزیکلی، ہر طرح سے وہ انڈر اسٹریسڈ بھی ہوتے ہیں، بٹ دے کین ناٹ شیئر اٹ ود دا پیشنٹ بیکاز پیشنٹ herself is also going through so many body physical changes or losing their physical appearance, losing their entire looks. تو میڈیکل پوائنٹ آف ویو سے تو ہم سپورٹ کر ہی رہے ہوتے ہیں، بٹ ایز اے فیملی، ایز اے گروپ آف فرینڈس، اٹس ویری ویری امپورٹنٹ. اور آپ لوگ سب سوچ رہے ہوں گے کہ بینگ ان دس انڈسٹری، میرا یہ ٹاپک میں نے اس لیے مجھے بڑی خوشی ہوئی اس میں بات کرنے کا موقع ملا مجھے، بیکاز میرے ہاں بھی بہت ساری ایسی خواتین آتی ہیں جو ہم سے سپورٹ چاہ رہی ہوتی ہیں، بٹ ہم تو ان کو پریکٹیکل سپورٹ دے سکتے ہیں، بٹ ہم انہیں سائیکولوجیکل سپورٹ نہیں دے سکتے. اور اس وقت پاکستان میں آئی ڈونٹ تھنک سو کہ کینسر سروائیورز اور کیئر گیورز کا کوئی پراپر، کوئی ایسا پلیٹ فارم ہے جس کے اوپر اینی بڈی کین گو اینڈ ask for their fears and questions and whatever, and how to take care of their patient. بہت سارے پیشنٹس ایسے بھی ہیں جو کہ بہت ہسٹیرک ہو جاتے ہیں، بہت ہوپ لیس ہو جاتے ہیں. sometimes they try to give up with their life, suicidal attempts کرنا شروع ہو جاتے ہیں بیکاز جن میرجز کی کو افیکٹ کرتی ہے یہ بیماری، تو ان کی جب میرج بھی بریک ہو رہی ہوتی ہے، بچے افیکٹ ہو رہے ہوتے ہیں، اور جوائنٹ فیملی سسٹمز جب ہوتے ہیں تو وہاں پہ یہ نہیں دیکھا جاتا ہے کہ جو ڈاٹر ان لا ہے وہ اس وقت کس ٹراما سے گزر رہی ہے، اس کے بچے، اس کا ہسبینڈ کس پرابلم سے گزر رہے ہیں. وہاں پہ اس سے پھر بھی وہی ایکسپیکٹیشنز کی جا رہی ہوتی ہیں. اور میں نے بہت کلوزلی بہت سارے لوگوں کو دیکھا ہے جو کیمو تھراپی کرانے کے بعد ان کو اتنا بھی ٹائم نہیں ملتا کہ وہ 1 سے 2 دن کا ریسٹ کر سکیں بچیاں. سو جو فیملیز ہیں ان کو ایجوکیٹ کرنا بہت ضروری ہے، ان کو بتانا بہت ضروری ہے کہ اٹ از آل گیم آف مائنڈ، کہ اگر ان کا ذہن، مائنڈ کام ہوگا، پیس پہ ہوگا اور انہیں سپورٹ ملے گی، تو آئی ایم 100% شیور کہ وہ that will be a amazing thing for them. And I am thanking RLMC team and all of the members in this team, that I must acknowledge that this is a very beautiful step that you guys are taking in the field of cancer survivor patients. اور اس میں بریسٹ کینسر کے پیشنٹس نہ بھی ہوں تو ڈفرینٹ جو ہیں پلیٹ فارمز اس کے پیشنٹس ہونے چاہیے اور ان کو سپورٹ ضرور ملنی چاہیے. تھینک یو سو مچ. اور اس کا کوئی کنیکشن کینسر ہاسپٹلس کے ساتھ ہونا چاہیے آپ لوگوں کی ٹیمز کا، تاکہ شوکت خانم ہو گیا یا بڑے بڑے جتنے بھی انمول ہو گیا، وہاں پر آپ لوگوں کی ٹیمز کے نمبرز ہونے چاہیے، اور وہ اینی بڈی شوڈ ہیو بین ایبل ٹو کانٹیکٹ یو. تھینک یو سو مچ. تھینک یو سو مچ.
Thank you, Ms. Ushna, for sharing your experience, views, and giving us some suggestions. Now I would again request Professor Dr. Nashi Khan, the chief organizer of this seminar, for the brief vote of thanks and the ending notes.
बिस्मिल्लाहिर्रहमानिर्रहीम. मेरे पास इस वक्त जज्बात ज़्यादा हैं, अल्फाज कम हैं, क्योंकि मुझे इस फोरम में के बाद वो सारा एक रिलीव हो गया, मगर what I as a cancer survivor or a warrior, मैं इस चीज़ को इस नोट पे एंड करूँगी कि first I would like to thank everybody, especially Professor Dr. Rashid Latif Khan, जो इतने मसरूफ़ होने के बावजूद भी मेरी एक फ़ोन कॉल पे उन्होंने कहा कि तू कहंदी है तो मैं इनकार किवें कर सकदा है, और जो लफ्ज़ और जो अल्फाज उन्होंने मेरे लिए इस्तेमाल किए वो शायद मैं डिज़र्व भी नहीं करती. हमने आफ्ताब मोहसिन साहब को मिस किया, वो नहीं जॉइन कर सके. मिस सबाहत ने पहले ही रिग्रेट्स कर दिए थे कुछ मसरूफियत की वजह से. तो मैं डॉक्टर प्रोफेसर रुबीना सुहेल, जो कि दोस्त भी हैं, बहुत पुरानी दोस्त हैं, उनका शुक्रिया अदा करूँगी कि उन्होंने मुझे कभी इनकार नहीं किया. फिर मैं डॉक्टर सलमा हसन का शुक्रिया अदा करूँगी कि वो भी इतनी मसरूफियत के बावजूद आ गईं. डॉक्टर फातिमा कामरान is very close to my heart, and a colleague also, and a very dear friend also, and again she can't refuse me. This is not that I'm boosting, but प्यारे लोग हैं जिन्होंने मुझे जिंदा रखा हुआ है. डॉक्टर हुमैरा मोहसिन बावजूद कोशिश के हमें ज्वाइन नहीं कर सकी, हमने मिस किया उनको सुनना. डॉक्टर उस्मान अमीन हुत्याना का भी बहुत शुक्रिया कि वो भी हमारी टीम का हिस्सा बने, बहुत सारी चीज़ें हाईलाइट की. मिस शर्मीन तारड़ मेरी बहुत प्यारी दोस्त हैं. ये नहीं कि ये कोई मैंने अपने प्यारों का ग्रुप बनाया है, बड़ा सोच समझ के बनाया था कि उन्होंने, और वो एंड में जिस तरह टीयरफुल हुई, उनके टीयर्स ने बहुत कुछ बता दिया, और वो अपनी फील्ड की बहुत टॉप की स्पीच थेरेपिस्ट हैं, और वो भी मुझे इनकार नहीं कर पाई, हालांकि मुझे पता है कि वो बहुत जगहों पे नहीं जाती. तो थैंक यू शर्मीन. और मिरात, यू आर ऑलवेज बबलिंग विद आइडियाज, having the energy, and once again I congratulate that you are a PhD now, you are a doctor now. Thank you so much. And और मैं आपको एक चीज़ बताऊं बड़ी इंटरेस्टिंग, अगर थोड़ा सा टाइम है, कि मेरे ये जो सब कोलीग साइकोलॉजिस्ट थे ना, जब इनको पता चला कि मुझे कैंसर हो गया तो ये गायब हो गया, सब बिल्कुल गायब हो गए, सवाए चांद देख के, जो कि मेरे बहुत क्लोज फ्रेंड थे, जिसमें मैं कभी शर्मीन का भूल नहीं सकती, डॉक्टर साइमा दाऊद एंड मेनी अदर फ्रेंड्स, मेनी अदर फ्रेंड्स, सबाहत की सपोर्ट और हमीद लतीफ़ की सपोर्ट तो अमेजिंग थी हम सब के लिए. तो मैं, मगर मेरे जो कोलीग्स थे साइकोलॉजिस्ट वाले जो थे, वो एक शेल में चले गए. तो मैंने अज्यूम कर लिया कि इन्होंने मुझे डिस्कार्ड कर दिया है और मुझे डंप कर दिया है, क्योंकि मैं किसी काम की नहीं रही. और बड़े एक्सपीरियंसेस मुझे हुए, जैसे कि मिस उशना खान ने कहा कि कुछ आपको छोड़ जाते हैं और कुछ आपको मिल जाते हैं. तो यही मेरे सफ़र में हुआ कि मुझे कुछ छोड़ गए, और आज मैंने भी उनको छोड़ दिया, और कुछ मुझे मिल गए और उनको मैंने पकड़ लिया. तो मैं, और आप यकीन करें कि जब मैं कॉरिडोर से गुजरती थी सेंटर फॉर क्लिनिकल साइकोलॉजी, तो ऑब्वियसली मैंने, जैसे उष्णा ने कहा कि मैंने विग नहीं पहनी, और मैंने सोचा कि अल्लाह मियाँ जब मुझे इस तरह देखना चाहता है तो मैं ठीक है इसी तरह. तो वो स्टूडेंट्स जो शायद जब मैं गुजरती होंगी तो मेरे से बात करने के लिए तरसते होंगे, उन्होंने मुझे सलाम करना छोड़ दिया कि इसको अब क्या करना है. تو میں یہ کہنا چاہوں گی کہ آپ کی ورتھ آپ کے ڈیزگنیشنز نہیں ہیں، آپ کی ورتھ آپ کا پروفیشن نہیں ہے مگر وہ زندگی کا بہت چھوٹا حصہ ہے. آپ کون ہیں، آپ کیسے ہیں، آپ کیسے جیتے ہیں، کیسے لوگوں سے پیار کرتے ہیں، یہ امپورٹنٹ ہے کیونکہ یہی ہم نے ساتھ لے کے جانا ہے. جب ہم جائیں گے تو میں ڈاکٹر ناشی نہیں ہوں گی، میں ایک میت ہوں گی. تو میں سشنا کا بہت شکریہ ادا کروں گی کہ وہ میری بھانجی بھی ہیں. آئی مسٹ سے دیٹ کہ میرے سے زیادہ شاید اسٹریس سے وہ گزری ہیں. میں نے تو شاید سب کو اسٹریس دیا ہوگا مگر لیا میں نے بالکل نہیں. میرے اندر ایک سینس آف ہیومر آ گئی تھی، شاید اٹ واز ڈیفینس ٹو کل دا پین اینڈ واٹ ایور. اور میں آپ کو 2 چیزیں میرا خیال امپورٹنٹ بتاؤں، جیسے کہ مس اشنا نے کہا کہ ہم ان کی ہر غلط صحیح بات مانتے تھے اور یہ حقیقت ہے. اب شاید نہیں مانتے، یہ بھی میں کہوں گی، مگر اس وقت یہ ہوتا تھا اور کبھی کبھی میرا دل چاہتا کہ پھر ہو جائے. اتنے فرما بردار سارے ہو گئے تھے کہ ہر میری غیر ضروری ڈیمانڈ، میں نے کہا میں نے حج پہ جانا ہے، میں نے کہا میں نے عمرے پہ جانا ہے ریڈیشن میں. تو the whole family went against us, but Ushna said, yes, I will take her. So we went and we did the Umrah and I was all fine. پھر میں نے کہا میں نے حج پہ جانا ہے. The whole family was against her that تم نے مارنے کے لیے اس کو لے کے جانا ہے. اس نے کہا نہیں، میں نے ان کی ہر خواہش پوری کر دینی. اور الحمدللہ ہم دونوں نے بہت خوبصورت عمرہ بھی کیا، بہت خوبصورت حج بھی کیا. اور اگر وہ مائنڈ نہ کرے تو میں نے ان سے زیادہ سپیڈ میں کیا. وہ شاید پیچھے رہ جاتی تھی اور میں آگے چلی جاتی تھی. تو میں اس وساست سے، اس فورم کی وساست سے آپ سب کا شکریہ ادا کروں گی کہ آج میں جو ہوں میں صرف ناشی خان ہوں اور اللہ نے مجھے زندگی دی ہے اور میں نے اس کو اچھے کاموں میں گزارنی ہے. اور یہ جو مس اشنا نے بھی کہا کہ ہمیں ایسا سپورٹ سسٹم کلینک بنانا چاہیے جس کا ایکسیس ہو، جیسے ریسکیو 1122 ہے کہ سب ادھر اپروچ کرتے ہیں. کیونکہ باہر کے ملکوں میں تو بتایا جاتا ہے کہ آئی بروز کے بال گریں گے تو کیسے ڈیل کرنا ہے. میں نے نہ شیشے پہ کاغذ چڑھایا اور نہ وہ کچھ کیا، اور میں نے شیو کروائی اپنے بہنوئی سے. And I was cool how I was looking, and now you can see me, and this is what I am. It's a brilliant journey. It has brought me closer to God. Jo shayad main hoti. It has brought me to bring more toba in myself. God has given me time. I take this disease as a blessing in my life. کہ اللہ نے مجھے اتنا موقع دے دیا معافی مانگنے کا کہ وہ شاید کسی ہارٹ پیشنٹ کو ہارٹ اٹیک سے نہ ملے. تو یہ بھی بہت بڑی بلیسنگ ہے. میں اس کو آج بھی بلیسنگ لیتی ہوں. میرے پیارے دوست، میرے پیارے اپنے کولیگز، آپ سب RLMC کے سارے کولیگز، IT ٹیم، امداد صاحب، شاہد صاحب، فرحان صاحب، معروف، I must thank you all for bearing with me, for bearing with my obsessions and perfection. And I also apologize that if I sometimes become a little strict, do things perfectly. So that is it. We have emerged as a good team. اور انشاءاللہ ہم ایسے فورمز انشاءاللہ اب لائیو بھی کریں گے کیونکہ کووڈ کا ہو گیا ہے، اور ہم ہر فیلڈ سے لوگ بلائیں گے. کیونکہ آپ نے دیکھا کہ شرمین نے اپنا ایکسپیرینس ایز اے اسپیچ تھراپسٹ بتایا، اور آپ حیران ہوں گے کہ میں نے بیوٹیشین کیوں بلا لی. تو دیکھ لیں ان کے پاس کیا ایکسپیرینس ہے، کیسی خواتین آتی ہیں اور ہمیں کیا کیا سپورٹ چاہیے. تھینک یو سو مچ. تھینک یو RLMC. تھینک یو پروفیسر راشد اینڈ ایوری بڈی.
Thank you so much, Dr. Nashi Khan. It's an honor to work with you. You are always an inspiration. My special thanks once again to all the worthy guests, especially Professor Dr. Rashid Latif Khan, all the worthy speakers, the whole management team for making this seminar a success. Thank you so much.